Welcome to a new episode of Medicine in 3 minutes. We go straight to the point. The subject is bravely made clear and often illustrated. Today's topic is about neural tube defects. Neural tube defects, there is a spectrum of disease including Spina Bifida Occulta, no protrusion of tissue, Tethered Cord Rope like Filum terminale, Dermal Sinus Track Meningocele, the defect in the posterior arc, Myelomeningocele Low sacral versus mid-lumbar, and Chiari malformation type 1 and 2. To understand the mechanism, we'll do a brief reminder of embryogenesis and their neurulation. Fertilization, die 1 zygote, die 2 two-cell blastula, day 3 four-cell blastula, day 4 morula, day 5 blastocyst, and day 6 nidation. Cleavage, division of cells, compaction, reduction of the volume, differentiation, trophoblast outside, and embryocyst inside. Cavitation with bilaminar disc. Here's the bilaminar disc. From bilaminar, we go to trilaminar with ectoderm, mesoderm, and endoderm. Ectoderm above the notochordal tissue rapidly proliferate to make an additional layer of longitudinal thickness called plate, neural plate, or neuroectoderm. Next, neural plates start depressing down and folding to form neural groove. Next, the neural fold will keep until they fuse with each other to make a neural tube. Neural plate depressing down, forming the neural tube. Another view. Neural plate border, neural groove, neural tube, and neural crest. The anterior neuropore closes at the 25 days for gestation, and the posterior neuropore and the 20 days with complete neurulation. The neural tube is the precursor of brain and spinal cord, and the remainder of notochord in adult is nucleus pulposus. Anterior neuropore close at 25 days of gestation, and posterior neuropore close at 27 days. Around this time, every woman should have implement folic acid in her blood. All female in productive age should have a good amount of folic acid in her blood. If there is a deficit in folic acid, the anterior neuropore will not close, leading to anencephaly, which it is not compatible with extrauterine survival. Posterior neuropore may not close properly, leading to spina bifida. What is spina bifida? It's a birth defect with incomplete closing of the spine and the membrane around the spine cord during early development in pregnancy. There are 3 main types: Spina Bifida Occulta. Occulta has no or only mild sign, hairy patch, dimple, dark spot at the side of the gap in the spine. Spina bifida is believed to be due to a combination of genetic and environmental factors. Spina bifida occulta, most common, the less serious. Most people never become aware of their condition, usually discovered only on X-ray or CT scan. Meningocele typically cause mild problem, sac of fluid present at the gap in the spine. Myelomeningocele on the other hand, also known as open spina bifida, is the most severe form. Poor ability to walk, impaired bladder or bowel control, hydrocephalus, a tethered spine cord, and latex allergy. Meningocele, the meninge covering of the spinal cord, pass back through the opening in the spine to form a cyst-like swelling. Myelomeningocele, this is the most serious type of spina bifida. It occurs if the spine cord is enclosed in the cyst. Etiology most common is folate deficiency, folic acid, and accessory diabetes, obesity, and smoking. Valproic acid or Depakote to treat bipolar disorder or migraine, and use neural tube defect with birth defect major fetal malformation like Spina Bifida. Remember, lamotrigine is safer. Diagnosis: maternal serum alpha fetoprotein elevated at 16 or 80 weeks of pregnancy. Amniotic fluid, AFP, alpha fetoprotein, and acetylcholinesterase enzyme. Differential: Tethered Cord Syndrome, neurological malformation of the spinal cord, tight filum terminale, Meningocele, split cord malformation, Diastematomyelia, Dermal Sinus Track dermoid. The filum terminale, terminal 3, is a delicate strand of fibrous tissue about 20 centimeters in length, proceeding downward from the apex to the Conus Medullaris. It is one of the modifications of Pia Matter. It gives longitudinal support. Sometimes there's fatty tissue thickening filum. Tethered Cord Syndrome, caused by tissue attachment that limit the movement of spine cord within spinal column. Diastematomyelia. Dermal sinus tract, here's a normal development, and here the skin is coming to the spinal cord. Here's the muscle, the subcutaneous tissue, and this is the skin. Here is the vertebral body. Here is the neural arc. Normal, Spina Bifida Occulta, Meningocele, Myelomeningocele. Prevention: woman pregnant for 3 months may be pregnant. If lady is maybe pregnant, 4 mg folic acid daily. All women at the age of procreating, and if she is pregnant, 1 mg daily. If she has prior NTD, 4 mg. Chiari malformation type 2, herniation of cerebellar vermis with hydrocephalus, myelomeningocele, accompanied by hydrocephalus. Let's recap. Anterior neuropore close at 25 days of gestation, and posterior neuropore close at 27 days. Around this time, every woman should have implement folic acid. If there is a deficit of folic acid, the anterior neuropore will not close, leading to anencephaly, which is incompatible with extrauterine survival. Posterior neuropore, on the other hand, if it doesn't close properly, to lead to spina bifida. Spina bifida is a birth defect with incomplete closing of the spine and the membrane around the spinal cord during early development in pregnancy. There are three main types: Spina Bifida Occulta. Occulta has no or only mild sign, hairy patch, damp, dark spot at the site of the gap in the spine. Spina bifida is believed to be due to a combination of genetic and environmental factors. Meningocele typically cause mild problem. Sac of fluid present at the gap in the spine. Myelomeningocele, also known as open spina bifida, is the most severe form. Poor ability to walk, impaired bladder or bowel control, hydrocephalus, a tethered spine cord, latex allergy. Differential Tethered Cord Syndrome, neurological malformation including tight filum terminale, lipomeningomyelocele, split cord malformation, and dermal sinus tract. Tethered cord syndrome caused by tissue attachment that limit the movement of spinal cord within spinal column. Diastematomyelia and dermal sinus tract. The skin is coming into the spinal cord. Chiari malformation type 2, herniation of cerebral vermis, accompanied by hydrocephalus and myelomeningocele. Thank you for watching this episode of Medicine in 3 Minutes. Would you like to click the button like and subscribe? Your suggestions are very welcome. Thank you.